It's time for the 420 Radio News, covering the latest headlines in consumer cannabis, medical marijuana, and industrial hemp. Transcripts of 420 Radio News are available daily on our website at 420radio.org. Now, here's Russ Belville with your marijuana headlines in 4 minutes and 20 seconds.
This is your 420 Radio News for Friday, January 16th, 2015. A big harvest of sun-grown marijuana from eastern Washington last fall flooded the market. Prices are starting to come down in the state's licensed pot shops, but due to the glut, growers are, surprisingly, struggling to sell their marijuana. Some are already worried about going belly up, finding it tougher than expected to make a living in legal weed. State data show that licensed growers had harvested 31,000 pounds of bud as of Thursday, but Washington's relatively few legal pot shops have sold less than 1/5 of that. Many of the state's marijuana users have stuck with the untaxed or much lesser taxed pot that they can get from black market dealers or unregulated medical marijuana dispensaries, limiting how quickly product moves off the shelves of legal stores. So far, there are about 270 licensed growers in Washington, but only about 85 open stores for them to sell to. The first of 10 investors in an Ohio marijuana cartel proposed by ResponsibleOhio is James Gould, a Cincinnati sports agent, businessman, and member of the board of directors of numerous organizations, including Build-A-Bear Workshop. Gould has represented a number of professional athletes and also serves on the board of the Corey Stringer Institute. ResponsibleOhio is pitching a ballot issue in which 10 investors would be allowed to grow and profit from the wholesale marketing of marijuana for personal use in Ohio. The growers would not sell the marijuana. That would be handled by unaffiliated retailers. The proposal includes a provision for legalizing the use of medical marijuana as well. The backers of the marijuana amendment have not released the text of the proposed ballot constitutional amendment or many details. That could come next week, they say. Critics call the plan cannabis capitalism and charge that it is focused entirely on profit by a monopoly controlled by wealthy investors. Marijuana edibles are blamed for a recent spike of child overdose cases, and now Washington State's King County health officials are calling for a pot candy crackdown. The effort to bring the unregulated medical marijuana commerce in line with the state's legal recreational market could result in a ban on many of the products currently sold at dispensaries. The goal is to eliminate things that would be, quote, especially appealing to children, end quote. There is no list of such items, but pot-infused cotton candy, gummy bears, lollipops, and similar items would likely fall into this category, according to staff at the State Liquor Control Board, which regulates the recreational market. There is also a bill pending in Olympia to eliminate sales of dried, smokable marijuana from medical marijuana dispensaries altogether, limiting dispensary sales to edibles, tinctures, and concentrates. Should both measures pass, critics contend patients would be left with nothing but bland, unappealing sources of cannabis medicine. Legalization of medical marijuana in Kansas is inevitable, Kansas Senator David Haley told a crowd of about 30 supporters at a rally in the rotunda of the Capitol on Thursday afternoon. Haley, a Democrat from Kansas City, and Representative Gail Finney, a Democrat from Wichita, have introduced companion bills in the House and Senate, SB 9 and House Bill 2011, that would allow medicinal use of marijuana. We have to get this done, Haley said. Quote, everyone in this Capitol knows that one day, medical marijuana will be available in every one of the 50 states. We know that. The question is, will Kansas be the 24th state or will it be the 50th? End quote. Finney said legalizing medical marijuana and taxing it would generate an additional $1.3 million in revenue for the state. They have at least one Republican lawmaker on board. Representative J. Basil Dannenbaum of Ellenwood spoke in favor of the legislation at the rally. Arizona's more than 63,000 medical marijuana patients ate, drank, or smoked more than 10 tons of marijuana last year. It comes out on average to the equivalent of one joint per patient per day, though clearly some are using more and some are using less. And figuring an estimated price of $350 an ounce, that meant Arizonans spent about $112 million on marijuana. A new report Thursday from the Arizona Department of Health Services also finds 85 dispensaries were up and running last year. More than 2/3 of qualifying patients are male. The average patient made 17 transactions during the year. The new report shows that one patient actually made 341 trips to a dispensary close to every day of the year. This has been your 420 Radio News for Friday, January 16th, 2015. I'm Russ Belville. Go Pack Go.